Okay. So it's good to be here. I have been wondering recently what it's like to be a Tottenham Hotspur player running out at Wembley, and I got a bit of a feeling for that, I think, right now. Obviously, for me, it's a little bit different this year, for those who know me. So having left Tunstall earlier in the year and gone into the world of home care. So I want to give you a bit of a picture of what it's like and how technology plays, or probably actually I should say doesn't play, a great role in the work that we do, looking after people every day. So a few facts. There are almost 900,000 people who receive home care of some nature in the UK. And that's with 600,000 care workers who go out to support them across 10,000 different registered locations who provide care. So that's almost 5 million hours of care every single week that's provided by people out in the community, going around, checking in and supporting people. Now, at the same time, I don't think it will have changed much. There's about 1.7 million people, I believe, still supported using telecare in particular, but technology-enabled care services in the UK. Some of those overlap. In fact, I've seen quite a few of our customers who also have telecare, but often that's not by design. So, give you a bit of a picture. At ARC, we operate across the country. We do about 80,000 visits a week to people. We help people get up and get prepared for the day. We make their food. We may clean them. We may provide clinical support for those who are seriously poorly. We even walk dogs. We do shopping. We may manage some of their day-to-day finances. And we'll help their family members. So pretty much all the different services that people might need day to day. And yet, when I arrived, I was probably a victim of having believed actually what I preached before when I was at Tunstall. And I was quite shocked by how little we actually use technology or integrate with technology in any way. I was with a lady this morning, she's 105, so we'd gone in to see her and take some flowers, and I was asking her, she had a pendant. I won't say which company it was, but it was a red lozenge. Anyway, so that person, so Phyllis, I said to her, "Oh, Phyllis, so you're wearing that pendant. Have you ever used it before?" She said, "Oh, I've used it once or twice." She was an amazing lady, actually, for 105, incredible. And so I said, "Well, what happens when you press the button?" I said, "Oh, well, isn't it you guys who come?" And of course, it's not us guys that come, but that's how she she saw it happening. So, thinking back to the beginning, I suppose, in terms of how do people see it? When I talk to people out, and I don't think this will be news to anyone, so our customers, what do they say when you say, actually, what's home care all about? And I use home care, I'm not talking about domiciliary care, I'm talking about being supported at home. They talked about the outcomes, what it means for them. They talk about being independent, they talk about having freedom, they talk about social engagement, so being able to contact people, be connected, and they talk about keeping well and healthy. So what do we do, and what have I been part of? Well, I've drawn these, they probably should be bubbles. So we've created bubbles. So we've created bubbles that actually pretty much operate independently. We see them as replacements for each other very often. So why have somebody come round to look after somebody when they can have an emergency alarm? So save some money there, or save some effort. And so we've created this group of alternatives to each other, which sometimes come together and sometimes don't. And probably I've seen in the last 3 months, visiting a number of our customers, actually it's really hit home to me how we need to start working together more, because at the moment, in reality, and I'm sure many people in this room have gone through this, is who fits all of that together? Well, it's usually the family. So they work hard with social care, they work hard with the NHS, and they're trying to fit together all these things that we all busily burrow away and try and do the very best that we can. But actually, for the individual and for the family, they don't necessarily connect and join up very well. So with that in mind, I think the thing that's pretty clear is that the fragmented services that we have and we've created impact on a really complex network of people, both professionals and family and individuals. I couldn't tell you how much paper we have in our organisation. And I'm told very often that actually we like to have paper because the CQC likes paper, which obviously isn't true either. So we've got lots of paper, we have lots of folders, lots of agencies, so we deal with lots of different agencies across the piece for individuals, and we're referring to their information constantly. There's a lot of chasing of providers for families to work out how things connect. There's a lot of creation. We have a lot of mental health issues with a lot of our patients. Many of them suffer from depression as well as other forms, so as well as dementia. I think one of the concerns that we have, that I have, is that it means that sometimes our loved ones can be treated as kind of tasks to get done, not just for us, but for anybody really. And so those families, who do they then turn to? And I guess from the health system's perspective is we've got quite a commoditized set of services. It's 15 quid for an hour of care. It's 15 quid for a month's telecare, as we were just hearing in Sweden. We don't use our resources effectively, so we're out in the community every day. We could be supporting in different ways 600,000 people across the country who are supporting people who are vulnerable every single day, which we don't really connect together. And the result of that, poor quality care, and I use quality in inverted commas because that varies according to the individual and how they feel. And our focus then becomes more around the statutory obligation of each of our pieces that we have to deliver. And that doesn't really work for us, I would say, and it doesn't really work for the individuals particularly well. So if we can join up technology-enabled care services and other home care services, what a difference that could make. I think Steve was just talking about some of the different services you can connect for people. And I know, certainly when I was at Tunstall, it's the kind of nirvana of all the services you can connect using IP, which is very true. The thing is, how are you going to do that? How do we make that work so that these things overlap and actually work in a much more seamless way? Because technologically, I think we all know there is nothing getting in the way, really. This is more about how do we want to work and what do we want to do. And even simply as saying before, how do we connect all those people who are out in the community much more effectively to give the care that we all want to provide? And so what we end up doing, I think, is we kind of, the innovation we have, we kind of trumpet that as a big steps in progress, and we're doing the same. We're working with the Silver Line in Lancashire, so just using the telephone to connect people and help reduce their loneliness of the people that we support. And in London, we've just got a geofence tracker that we're using, which means for those people with dementia, when they go out of specified areas, as we all know here, we can go and help them. And actually, the positive thing about that is they're getting help from the people who look after them. So if you've got somebody who's confused and scared and got dementia, and they're out in the community in Brent, and actually they see a familiar face who comes to see them every day because we've managed to connect that for that person can make a big difference, and it's a very practical way of being able to take things forward. So, of course, I guess technology can help us provide better services, and I think about that in terms of real-time and more transformational. And the real-time stuff, if I think in our business, we're using really scheduling tools. Really, is probably the only technology that I would say that we're using that's really effective and pushing out our rotas for people onto handheld devices. That works really well. But you can also start to understand the needs of people in the moment and do much more around their personalized care planning if we connect the technology well for them. We're there. Our prime role is to support people and keep them safe, safeguard them. And yet I find it, for us, it's even odd that we're not providing that in tandem with a support service which can help them avoid some of the risks and respond to risks. At the transformational level, how do we proactively intervene and design home care services and the kind of services that count for people in a different way? I think engaging the family in a way that works for them. We talk, I think, a lot about platforms, about social media type platforms, about engaging with the family proactively, pushing messages out, getting messages in. But actually, what's the way that works for people to receive that message? So, I'm sure I'm not alone. I know that in our own family, if you get that message to say, something's happened to your parents, part of you is thinking, oh my gosh, what am I going to do about that? How am I going to respond to it? So how do we do that in a way that works and starts to get us into a place where we have integrated services and start to move into that population health management kind of space? And then you've got the data. Masses and masses of data that's out there in terms that's collected, that's written down, that we capture every single day about how people are feeling, whether they've taken their medication, whether they've been doing their exercises that they need to do, whether their nurse has called. the only challenge with that, and Steve and I were talking about this earlier, is with that comes a level of fear. So data is a fantastic thing until then you start to say, okay, well, so who's now, if I've got all the data available, who's responsible or accountable for responding to some of that data coming in? At what point does that move between the different agencies that are involved in supporting someone? And certainly in conversations we've had around starting to get more engaged around text, the conversations we're having with some of the commissioners and other parties is at what point do I now become accountable for looking after that person if that data is available to me? So I'd love to be in a place where our guys could go out, and I'm sure my teams would, where they can go out in the morning and they know whether that person's had a good night's sleep, whether they've had to get up in the night, how they've been, what's been going on, and they can have a different conversation with them, but also they can respond to the needs they have straight away without having to ask them a whole set of questions as soon as they arrive in order to try and find out what's going on. So I guess for me, my take would be if we can start to progress more down those lines, where we can start to use this integrated sets of data as well as technology, it can make a massive difference to the people that we're all trying to support in different ways. And I think it's one of the reasons why over the last 10 years, since the big surge, I guess, in terms of technology-enabled care services in the UK, it's kind of stalled. And whilst there's been lots of progress and our lives are completely changed, transformed by the use of technology, we're in a place where actually my teams go into somebody's home and they almost forget how life actually works and that things are so very different around using technology. And we've got to find a way, I think, as Steve was saying, of trying to bring that into a much more of a mainstream, but working together. We can't do that as just the industries, different industry segments on their own. And the market's changing. I mean, we all know that. We've talked about that earlier. How engaged families are getting, the move to personal health budgets, much more of a consumer-led society, but also, people will become more demanding, and I can promise you, people are very demanding when it comes to either their own care or their care of their parents. So how do we start to pull that together? Now, the bits on the right there, in terms of, that's nothing new, that's stuff that's been on slides for probably the last 7, 8, 9 years, I would guess. But it's still an aspiration. And that doesn't make a lot of sense for me about why that's an aspiration. And so for me, we've got even a session tomorrow about, well, how do we start to connect these things in a much better way? Because right now, if I'm really honest with you, I don't think that works very well. And that's not blaming any particular individual or party, that's kind of all of us about how we bring that together. But the potential we know is huge. And even some of the small changes, the small changes can make a massive difference of connecting these things together, even though the technology can take us a lot further. So I'm hoping that over the next few years, particularly, we're going to be able to really change the way that, from the perspective of providing care in the home, that can be integrated with technology and data and people, because you need all three of those. So thank you very much.